So, welcoming spring and adapting to climate change. This has been a regular update that I have been doing since 2019. So, this is a TCM health betterment for spring updates. It's also considered the health betterment for February 2025. For those who are new to me or introduced by your friend to join me, I'm Dr. Clement Ng. So this is a short profile of myself. I'm not a first career TCM practitioner. I'm an engineer by training, and I spent more than 25 years in the corporate world, spanning from IT industry, subsequently to manufacturing, to defense, to ministry, as well as to TCM industry. So that's something about myself. So I'm currently the chairman for the Technical Committee on Complementary Medicines, a committee under the BioHealth Center Committee under Enterprise Singapore, looking at the standard development for Chinese medicine, complementary medicine, health supplement, as well as going forward, yoga and Ayurveda. So I'm the president for Singapore Acupuncture Association now, and I represent Singapore in the ISO TC 249, the international organization looking into the standardization for Chinese medicine for the world. And I'm also appointed as executive director for the World Federation of Chinese Medicine Society in the 5th Executive Council until year 2029. And I'm being invited as a vice president for the committee in Standard Construction Committee. And I'm also a committee member at World Federation Acupuncture and Motivation Society. So that's something about myself. So, and just to highlight to you, what is TCM and you? I take this opportunity to share about my own company. I established TCM and you in 2003 as a website, trying to share and propagate to every one of you out there about Chinese medicines. And to me, Chinese medicine is more than just about nourishing, heat cleansing, detoxifications. Chinese medicine is about how to make you to become a beautiful you, stronger you, calmer you, smarter you, and healthier you. So I just want you to know and what you need to know about all this from TCM and you. So I developed a series of programs, and all my programs so far approved and supported by SkillFuture. But the reviewing process is underway, hoping that you will be continue. If not, all courses support will be end March 31st this year. So if you're a friend who would like to use your SkillFuture for something that can last them for the whole lifetime, that's health knowledge, they are encourage them to join my subsequent class. So today I'll be discussing the following: the basic principle of health betterment. I'll touch on the symbolic significance of spring, why I take this opportunity to share about health betterment at this time. We'll discuss about climate change and health challenges coming on board. Have a special discussion of influenza A. I believe a lot of you are very familiar with it by now. Someone famous just died because of this flu. And I'll also discuss about key area of spring health care and some psychological health adjustment, lifestyle adjustment you need to put in place in the coming months. So, without further ado, some basic principle of health betterment in TCM perspective. Chinese medicine is one of the oldest medicine systems in the world. It has been around for more than 5,000 years. And you'll be many years to come, you'll still be there. Chinese medicine advocate prevention to prevent before disease strike. To a lot of individuals out there, this statement doesn't hold much value because of those who believe in evidence-based medicines. First of all, I always highlight that I support evidence-based medicines. But I want to share with you that if things become evidence, it becomes too late. So how we can prevent before disease strike? Illnesses don't happen overnight. Illnesses then can never happen affecting you because of what you did yesterday. For example, you have a diabetic, you have a high cholesterol, you even have a cancer. It doesn't happen yesterday. It happened for many, many, many years to come. So how can we prevent illnesses, disease before it strikes? Prevention. To understand all this, you're advised or you're recommended to join my fundamental class. And to intercept before pathological changes. And this is important because many of us will suffer chronic illnesses. For example, I myself is already 56 years old. I have high blood pressure. There's nothing wrong about that, considering my age. and to intercept before pathological changes. Meaning, if you are diagnosed with diabetic, should you diagnosed with high blood pressure, should you diagnosed with high cholesterol, is that something very, very serious? Yes and no. Can you continue with this particular condition throughout your entire life, assuming that you're going to live to 90 and 100 years old? The answer is yes. But the idea is if you don't manage it well, when things become complicated, when complication happen, then that's where problem come. So it's need to intercept before pathological changes. And there's also another important element known as to nourish after recovered from disease. Now, this is something that I always highlight with regards to this important relapse preventions. In my discussion with stroke, I have come across and I bring forth that there are 10 possible reason and causes that individual will have a stroke. So one day, if a patient, because of the underlying condition, had a stroke, and eventually when he or she discharged from hospitals, does this 10 condition that trigger his or her stroke disappear suddenly? Answer is no. You still be there. So you need to take precautionary measure to nourish to prevent the same thing that may happen again and again. So this is where you need to nourish before after recover from disease. And I believe it will come because individuals out there where they have subsequent multiple, I should say, they have multiple COVID or multiple flu. Why they have multiple flu? Because their body constitution was not being adjusted or nourished after an incident strike. And in order to do that, you need to understand and appreciate the fact that according to season and timing, according to locality, according to the individuals, every one of us are different. None of us are the same. And in this topic discussion today, I'll be talking about season and timing. And for those who'd like to know more about how Chinese medicine can help you, you're welcome to join my course on TCM Fundamental Essential Diagnosis. And the last run will be in March, Friday. You can join my class. And so these are the details I'll send to all of you who have registered for the Zoom class. And coming on the March as well, I'll be discussing about basic medicated diet class. You'll be learning to eat according to who you are as a constitution, according to the season, the timing, according to the locality. For example, we're in Singapore. Why we eat certain thing unique to Singapore and according to the condition illness that you may have. To me, a best diet is not a vegetarian diet. It's not intermittent diet. It's not a keto diet. The best diet is a diet that meets your body constitution needs. So if you like to know more about the medicated diet, how it can help you, you can join this class. And coming Friday, I have a last run for my women's health class. I have a specific course of women's health and TCM pediatric care because these are the unique group of individuals that we need to take care of. Why women specifically? Because women compared to men are more complicated, as you know. But beyond that, women have what we call menstruation, lactations, childbirth, pregnancy, menopause. So that makes a woman's health in the entire phases of life more interesting. And there's a saying, if you can take care of women's health, the man's health is given. Men are quite simple, only one life. And I believe some of you here may be been told before, if you are not good in certain constitution, by going for a particular phases of childbirth, you may be able to adjust and be a better woman. But the reverse is also true. So this will be discussed in my class, and we will skip the Valentine's Day for you to spend the time with your loved one. And I'll discuss about the course we talk about, the symbolic or significance of spring. Every quarter, I have a sharing. In the last quarter, in November 21st, I touched about beginning of winter. And I discuss and share that there will be a time where in the Singapore become very cold. And that's mid-January. So this year, mid-January was very cold. And going forward, we are going to discuss about this period, starting from 3rd February. And from this period onward, we are entering spring. So the symbolic or significance of spring is a transition to a new cycle, where spring marks a transition into a new seasonal cycle, symbolizing flexibility, adaptability, and resilience. And adjusting the seasonal changes with one of the onset of spring begin or commencement of spring is essential to align with the seasonal changes, adjust our lifestyle, and enhance physical reliance to prevent illnesses from occurring. While Singapore is 1 degree north, a lot of people claim that Singapore have no four seasons. But the truth is we do have, because we are 1 degree north of equator. So our general weather patterns mirror that of the northern hemisphere. So let's discuss about the climate change and the health challenges coming forward. As I mentioned, according to the solar terms, reflecting the health update I shared in November 2024, we mentioned that as the weather gradually turned colder, many people experiencing symptoms such as leg, foot pain, rheumatic pain, numbness in the hand and the feet. And I also discussed about that period correspond to a higher incidence of stroke. And you should recall around your friend, your relative, they may have such an occurrence there and then as well. Because every day we are looking at least 26 strokes per day in Singapore. So in the recent major cold, around the period of Jan 20th, there's a period correspond to the colder season in Singapore during the particular period. So Singapore weather temperature dropped to about 21 degrees. And now we are picking up. So this is a unique weather pattern, seasonal changes in Singapore. We are going to Li Chun at this period. And I do a sharing every quarter because during these changes, the yearly Chun and the New Year is only a few days apart. And so, as I wish every one of you here happy Chinese New Year, Lunar New Year, and today happy birthday, 人日. So, with the arrival of significant of solar term, there's a noticeable change in the natural atmosphere. The weather getting warmer now. Young energy start to rise and bring vitality. So, seasonal changes in Singapore is like that. While we may not experience 4 distinct seasons, the spring begin period from February to April bring fluctuating temperature and humidity level. And what happened now is daytime may be warm, nighttime will be cooler. So temperature remain warm, even evening can be cool, increasing the risk of rheumatic discomfort, nasal, allergic, colds, and what we call respiratory issue. So these are conditions that's happening nowadays, and this is a chart that I show in many of my sharing. While we don't have 4 seasons, the Singapore weather pattern mirror that of the northern hemisphere. So as the northern hemisphere entering winter, we are also going to the cold weather. And currently we are approaching this particular phase of weather, where temperature rising up. And this weather itself, because of the melting snow, melting ice up north, the cold air will start to chill and blowing downward. We are experiencing slight warmth going forward. An individual with certain symptoms associated with wind. Their symptoms will, on our bodies, respond significantly to the changes in the weather. And because of a certain phenomena, weather phenomena, we call it the La Nina effect. It may influence the Southeast Asia in 2025, according to the Meteorological Agency, bringing higher rainfall, elevated humidity. And because of this increased humidity, increase in dampness in the body, weakened spleen function, sluggish digestion, fatigue, and phlegm accumulations. And during this period, it's important for us to strengthening the spleen system. Because as a result of this particular dampness condition, we need to strengthen the spleen. One of the conditions I share in my TCM fundamental and diagnosis is when you stick out your tongue. In the class of 30% here, 60% will have the tooth mark around your tongue. Don't believe me, later you take a look at your own tongue. In Singapore conditions, 60% of Singaporeans will have a teeth mark along your tongue. Why this happens is because of a phenomenon known as spleen deficiency. When spleen deficiency occurs, you will have this so-called qi deficiency of the spleen. And most Singaporeans are fat because of water retention. And once your spleen is weakened, your body acts like a sponge. It absorbs moisture from the environment. So there's another condition known as respiratory issue. There's been a rise in respiratory infection, including cold, flu, coughing, asthma, and allergy. And this point, let me bring in another part of the discussion. Every discussion, every quarter, I'll bring in something new. And there's a condition known as influenza A. I believe all of you are aware of it. Huh? And many people around us are suffering influenza A, and I see more of such patients in the clinic. And there's one famous artist just passed away because of influenza A. So at this point, I just make it a point to share something with all of you and understanding of influenza A and its causes. And just to highlight and disclaimer, today's material are prepared with support from ChatGPT, with support from DeepSeek, with support from Baidu AI. So this entire PowerPoint that you're going to see are presented and prepared by Baidu AI. So understanding influenza A and its causes. I'll talk about an overview of the influenza A, the transmission mode of influenza A, common symptom of influenza A, and how can Chinese medicine help, and some conclusions. So let's discuss about influenza A virus. It's a virus. So every one of you here are quite familiar with virus. The shapes may not be like this, but what's a virus? We are aware of COVID. So influenza A is a highly contagious virus infection that affects the respiratory system caused by influenza A virus, a member of the Optomyviridae family. And in virus mutation rate, influenza A has a high mutation rate and can spread rapidly, leading to the seasonal flu outbreaks and even global pandemics. So this can be conditions. If you can recall, during the SARS, you're advised not to go Hong Kong. During the COVID, you're advised not to go Wuhan. And now I believe you heard that you're not to go, don't go Japan. But anyway, this is something that you understand. So when the influenza virus is in the air, and a lot of people are getting it nowadays. I have patients coming back from Japan, got it. And it may be a virus, but virus is not, when it attack a human body, everybody behave differently and depends on your body constitution. So what are the transmission mode of influenza A virus? By now, all of you are very familiar with how to manage this condition. And I strongly advise all of you to wear a mask going forward. There's nothing wrong wearing a mask nowadays in Singapore. Everybody wear masks nowadays. I wear mask when I see all my patients. This is my personal responsibility to make sure I don't create additional possible factor to affect their health. So what are the transmission mode of influenza A? First of all, respiratory droplet. When infected person coughs, sneezes, or talks. So this can be prevented by wearing a mask. Surface contamination where the virus remain viable on objects like doorknobs, handrails, electronic devices. So wash your hand. And remember one thing, don't ever use your bare hand touch your eyes. That's the last barrier. A lot of people during the COVID period, they clean out everything, but when their eye itchy, they touch the eye and they get the virus. And it may be airborne transmission, especially in a crowded and poorly ventilated place. So if you go to take any public transport, in the lift, wear a mask. So it's something you need to appreciate. And what's the common symptom of influenza A? And a lot of you, I believe many of you will have family member already in this state. The symptoms of influenza A include fever, very common. Cough, yes. Sore throat, yes. Running and stuffy nose, yes. Body ache, not too common. Headaches, fatigue, shortness of breath in severe case. So this is something that we are familiar with as well. And some may have gastrointestinal symptoms, such as children more likely experiencing gastrointestinal symptoms such as nausea, vomiting, and diarrhea with influenza A. And for Chinese medicine perspective, why this thing happened is because the lung and the large intestine, they are symbiotic pair. They belong to the metal elements. So when you have a upper respiratory system conditions, At the same time, chances are you may have constipation or diarrhea. And those in the high risk groups, they are similar in all situations, including young children, pregnant women, elderly, who are individuals with weakened immune systems or chronic illnesses. So this is where if you belong to this category, do take personal precautionary measure. There's nothing wrong wearing a mask nowadays. So how can TCM help? We can consider herbal remedies such as one particular formula, 生脉散. This is a formula for those who are familiar with me teaching a class. I always drink this. It basically make out of 人参, ginseng, 麦冬, opiopogon, and 桂子. This is a drink that I always drink in the class. Why? To strengthen my energy, strengthen my qi. And for those who are keen, it's available on my website. And for dietary light adjustment point of view, you can consider a particular herb known as astragalus 黄芪. Or you can consider eating warm food such as ginger, garlic, onion, and green onion. For example, if you're having a cough at this moment, having difficulty falling asleep at night, go ahead and prepare a ginger drinks. Ginger belongs to the pungent category and is very good in helping us to address what we call the lung-related conditions. So in terms of treatment-wise, when it comes to influenza A, through diagnosis, the practitioner will have to determine whether your current condition belongs to the wind heat invasion, symptoms such as fever, sore throat, yellow phlegm, body ache, dry mouth, thirst. And treatment will be focused on clearing heat and dispelling pathogens. If we diagnose as a wind cold invasions, symptoms such as chill, more than fever, running nose, body aches, headaches, no sweating, treatment will involve warming the body, dispelling cold pathogens. Or it can be a case of qi deficiency and lingering infection. Those who are born with, you call it hyperhidrosis, tend to perspire more than others. Cold hand and cold feet, these are typically below the qi deficiency. And symptoms such as prolonged fatigue, shortness of breath, weak cough, night sweat, nocturnal perspiration. Treatment will focus on tonifying qi and resolving infection. How to determine which one particularly belong to? You can consider join the fundamental class essential diagnosis. I'll teach you how to identify those things. And for those who have damp heat accumulation in severe case, you may have high fever, thick yellow sputum, chest tightness, difficulty breathing. And treatment involves clearing heat and draining dampness from the lungs. So this is where, from the diagnosis perspective, identifying what can be the possible problem that triggers such a conditions. So acupuncture, such as the point for immunity acupressure, 合谷, 列切, Li4, Lu7. This is on the wrist area. Later I share. And point-wise for energy boosting, ST36, 风池. So in conclusion, when it comes to influenza A, TCM is a comprehensive approach in preventing, treating influenza A by strengthening immunity, balancing body constitution, targeting specific symptoms. Your personal responsibility is wear a mask, avoid crowded place, and strengthen your immunity. Virus don't care about who you are. We have all been through pandemic, COVID pandemic. Rich or famous make no difference when it comes to virus. Your immunity is everything that matters. So combine TCM with modern medicine, it can be effective, should be used complementary with modern medicines. So if you are diagnosed with a virus, bed rest important. Since some symptomatic application fever-wise, you can go ahead and take the medicine prescribed by your doctors. So that's for discussion on influenza A. Then let's come back to our understanding of respiratory. So I have basically outlined the respiratory infection. And in the case of current weather season that we are going in, under the commencement of the spring, because of the dampness and the wind and the rain that coming along, wind and dampness increasing during this period, and the La Nina potentially contribute to persistent moisture. So the body becomes susceptible to respiratory issue. So they notice there's a lot of people when they had a sneeze in the morning. And this condition typically is part of the situation in Singapore where our humidity is more than 95%. So important to strengthen the immunity, protecting against seasonal changes will be the key to staying healthy during this period. So what are the key area of spring health supports? One area is called acupressure massage. Tomorrow night I have a new class of a basic acupressure massage. You're welcome to join. And this will be the last run if the review or the renewal process never go through. I have yet to heard from them. All my support for my UTEC will end 31st March 2025. So if no news from them by end February, this will be the last run. Basic acupressure massage for wellness, learn about technique, massage, cupping, moxibustion technique online, but it's good enough. So this class will be tomorrow evening from 7 to 10, run for 4 sessions. 19th, I'll be conducting the course overseas. And in my sharing with all of you, there's this particular point, rubbing the rib side, 奇门穴. This acupoint is the last acupoint on the liver meridian, 奇门, at the 6th intercostal space below the nipple. Nipple consists of 4th intercostal space. Directly below the nipple and below the breast. This point helps to regulate livers. And this point important because, for example, you are very tense. Rubbing this point is very relaxing. For men and women, it's the same. So place both hands under the armpit, rub along the rib cage, toward and chest for 30 times. Help alleviate stress, promote smooth liver energy flow, prevent emotional imbalance. When it comes to emotional challenge, you are the personal cure. Don't blame others. Nobody is responsible for your emotions. Remember this. When you always say someone make you sad, not someone make you angry. But the moment you respond emotionally, there's only one person that will be injured, and that's you yourself. So next point, 足三里, strengthening the digestion and for immunity. This point is located 3 chun below the depression of the knee, 1 finger breadth from the anterior border of the tibia. So to find this point, first thing, identify the depression on the knee. And 3 chun equal to 4 finger. So this is the point. So 足三 is a point to regulate immune function, enhance disease resistance, and tonify the spleen and the stomach. So apply moderate pressure 3 to 5 minutes in the morning, evening while taking a deep breath. Taking a deep breath is a very good exercise. So supporting digestion, enhance immunity, help expel wind, dampness from the body. So this is the point again. Next point, we call it Tai Yuan. Number 9 point on the lung meridian. Pressing the Tai Yuan, strengthening the lung, preventing cough. On the wrist, here, near the base of the tongue. So the point is right here. So to find this point, what you can do, apply firm pressure for 1 minute while taking a slow, deep breath. Press. Trace all the way from the thumb below. Press. It supports the lung function, relieve cough, protect against respiratory infection. So one simple action you can do is do this. Rub around your wrist. This point is another point opposite called HT7. So the point is for the heart. It have a calming effect. So this is for the lung point. And brushing your teeth, brushing your scalp, comb hair, activating young energy, refreshing the mind. At the vertex of the head, this is aggregate point for the body yang. We call it 百会. So main point for treatment for headache and dizziness. Those who know me, I comb my hair, scalp 200 times a day, minimums. So these are the video that I'll send to all of you. Any one of you who have registered to the Zoom, you'll get this edited PowerPoint slide as well as a video after I compile them. So use the white tooth comb, brush from the forehead to the back of the head while gently massage the scalp. So comb. Promote blood circulation, relieve headaches, improve mental clarity. So this is how you can help yourself. And for medicated diet, you can consider joining my course, TCM Medicated Diet class, and the last one will be in March as well, Monday evening. So from the 10th, 27th, 24th March via Zoom. And for diet recommendation here for the coming months is to strengthen the spleen and reducing dampness. So you can consider yam, koic seed is basically barley, lotus seed, white lentil, pumpkin, poria. These are known to be able to help us to clear dampness. Moisturizing the lung, reducing allergies, lily bulb, pear, almond, honey, monk fruits. You can consider bird nest as well. Detoxifying and cooling the liver heat are mung bean, goji berry or woodberry or chrysanthemum, cassia seed, yellow daily lily. This can help to detoxify, cool the liver. And to support the young energy, you can consider lamb, black sesame, walnut, goji berry, polygonadum roots, 黄精. And for the coming months, some of the health adjustment strategy you can consider. First of all, adequate sleep. Go to bed early. Wake up early. Follow the rising young energy. Enjoy high quality rest and lay a solid foundation for a healthy day. And just to advise, I have written 4 books so far. My next book will be on insomnia, how TCM can help you. And just to highlight a very important understanding here. Every one of us are blessed with 32,000 days. Some of us already passed, for myself, more than 16,000 days. I will left with myself for another 16,000 days. And that's a fact. Every day lost, every day gone is a day gone. So should you have a very late sleep tonight, make sure you wake up the same time the next day. Because today is lost. Tomorrow, please make it a full day. So that's something you have to tell yourself. No matter what time you sleep late, always wake up at the same times. So that subsequently your body will become tired and timing can be adjusted back. So this is about sleep. I'll be coming out this book. I will let you all know once the book is ready. And practice exercises. Tai Chi, walking. For example, I have a walk every morning whenever I can. For example, this morning I went for a walk around the Woodlands Health Park. Nice place. And I practice 8-session brocade, 八段锦. I teach 八段锦. So after my course ended funding support, I'll be running 八段锦. So what's 八段锦? This is a program that I've done. You are welcome, invited to like and share TCM at your website. There are many good videos out there, but nothing, I'm not a joker basically. So anyway, this is the 八段锦. This is many years ago, a younger me. This is the first module, first stroke. This is the second stroke. Combining 八段锦 together with sound. This is if you are keen, you can go and take a look. This one is important for the liver. Okay, when you are free, go and take a look. So this is called 八段锦. Enhance immunity, promote blood circulation, reduce invasion of seasonal disease. It's very important to practice this particular exercise called Qi Gong. What is Qi Gong? Qi Gong is nothing religious. If you do a deep breathing, inhale, exhale. If you count your breathing, it's called Qi Gong. And if you can reduce your breath to 1 minute to 2 to 3 breaths, and that itself is very calming. So moderate exercises. As well, I try to do something called foot care. Soak leg at dusk or in the evening in warm water. Massage acupoint, activate meridian, prevent cold, improve overall health. So take a look at the video. Warming your feet to improve your sleep. There are many individuals out there wear socks before they sleep. My advice to all of you who are wearing a sock and sleep, wearing a socks over a cold feet serve no purpose. So in this video, I share with you that you should always wear a socks over a warm feet. Warming your feet first. So you are free, go and take a look at the YouTube. Let's don't waste time here. And manage your emotion, as I said. Maintain the present demure. Maintain calm mindset. Avoid liver depressions, spleen deficiency. Maintain physical mental harmony. Enjoy the beauty of spring. Remember, nobody is responsible for your emotions. For things to happen, there must be a stressor. There must be a stress response. All emotion is a manifestation of our past experience. When you see something, you react upon it because your past experiencing tell you that you should respond that particular way. But when you responded, it doesn't make a lot of difference. So manage your emotion, because whenever there's an emotion surge, only one person will be injured. That's me, myself, and I. Remember this. And moisture prevention, wear breathable clothing, live in a ventilated room, avoid prolonged exposure to moisture, prevent invasion of dampness. And this is where you can advise to stay in the air conditioner room. I have a strong support of sleeping in an aircon room. An aircon room is not a cold room. You can see this video on my YouTube as well. So you're welcome to join my program on sub-health management. What is a sub-health? Sub-health is a state where you are not feeling well, but all the medical indicators show that you are well. So are you well or not well? So this is where you are interested to find out more, learn about sub-health such as insomnia, gut, gastroesophageal reflux disease, vertigo, hyperhidrosis, polyuria. You can join the program. There will be the March, Wednesday, 7 to 10. Meridian Knowledge and Skill class, this will be the last one, will be in the month of March. I stretch all the way to April, May, because the starting date must be 31st March. So this is the last class I will start, and it was approved, and will run all the way to May. So for those keen to learn more about Meridian study, you're welcome to join this program. So these are the courses that I'm running, and you're welcome to join. And just to take this opportunity to also share with you that in the coming month, all my courses, if they are not approval given, I never inform all of you, the class will stop. So let me go through my course preview. This essential TCM skill for health and wellness practitioners, it has been around since 2020. Now it's 2025. So it's a good 5 years. So the courses so far are supported by SkillFuture and as well as NTUC UTech. So from this period onward, if you are keen to attend or any of your friends who are keen to attend to make use of their SkillFuture credit, where $500 will expire by end of this year, learn something about health, it will benefit you forever. Because while health is not a tangible skill set, it's a skill set that above all, without health, all your knowledge and skills is irrelevant. As I discussed and shared in my previous courses before, I was in the corporate world for more than 25 years. I managed a big department, not too big, about 50 of them. When my patient, pardon me, when one of my staff have a cancer, and when I review the case to my CEO, the first statement that he asked me is, "Do you need a replacement?" It's not even which hospital he was in. So anyway, take care of yourself, because your health is everything. Without your health, your job is irrelevant. Because I retrenched people when I was 30 years old. I understand how the whole process works. So learn about health. This program will be running. The last course of fundamental will be in March. Meridian in March. Acupressure starting tomorrow. Basic medical diet in March. And pediatric care, I already completed my last run. Not sure whether I want to run again or not. And women's health will be this coming Friday, likelihood to be the last one. There's a pain management class also in March. Stock secure management in March. So I basically try to squeeze everything into February and March. And let's see how it goes. And after my program end with the Skill Future or NTUCU Tech, my courses will continue to be in PA, Skill Future at PA. So if you are interested in the coming months, there's courses running in Toa Payoh East CC, Pasir Ris East CC, Hougang North residential networks. So you can go to this particular website to find out more. And there's a question asked about Udemy. I have been on Udemy since 2015. So this year marked the 10 years of my courses on Udemy. My courses on Udemy, my TCM class is the first TCM class on Udemy. My TCM course was the first course on Udemy supported by SkillFuture. And currently I have more than 148 countries, 49 countries, with more than 6,500 participants now, more than 10,000 enrollment. So this QR code will change. I'll send you the most updated one. So these are the program that you are keen to join. You are welcome to join them. So these are the different courses that are currently running. Okay, if you are keen, you can always join them. Okay, so that's about all for the sharing today.